Hi, my name's Scott McGann with the Falmouth Health Department, doing the Town of Falmouth's weekly COVID-19 update for May 21st, 2021. The town's website is falmouthma.gov. If you want to email the health department, it's health@falmouthma.gov, and the Falmouth Health Department's phone number is 508-495-7485. So, as of Monday, the guidance has changed. All COVID-19 sector-specific guidance, gathering orders, and most mask mandates expire May 29th, 2021, so in about 8 days. Masks will still be required at K through 12 schools during mass transportation, such as planes, trains, and automobiles, and congregate and healthcare settings. For the most part, occupancy and all that, everything goes away on May 29th. So, in terms of vaccine eligibility, anybody over the age of 12, that hasn't changed. What has changed is the pre-registration system at the state that we have a link right now on the website we'll have to take down is going to be closed on May 25th. Up until then, over the next several days, all remaining people in the system will be contacted with an opportunity to book an appointment before closing out the system on May 31st. Okay. The Vax Finder will remain at mass.gov, and that will show you all the different areas. There's 900 locations with thousands of appointments. Also, large clinics that have been running, like at the fairgrounds, are going away based on the low uptake. You know, if we're getting 25 to 50 people at a clinic when we have 25 people there to run it, doesn't make a lot of sense. Four Cs will still be having some through Barnstable County, but eventually that'll be sunsetted. There's plenty of doses available, same or next day at the pharmacies. I had somebody inquire. I went on, it happened to be Walgreens, and they had like 20 appointments for yesterday. So if you want one, there's plenty of availability at the pharmacies. Mass clinics don't make any sense at this point. Homebound, those that can't make it to a clinic in Falmouth are still call the senior center, 508-540-0196. We do get that in dribs and drabs. I think we have 15 to 20 of them scheduled for early next week. And if you happen to find someone, or you've come back here to Falmouth from being away during the winter, and you find that there's a neighbor who hasn't been vaccinated and they haven't reached out, we'd like to know that. So the senior center is the clearinghouse, 540-0196. And since the guidance had changed for vaccine for 12 to 16, we're going to run a series of 12-plus clinics during school, scheduled with the school department and Barnstable County Health, the ones that are going to bring the nurses and the vaccine. It's going to be at Falmouth High School. It's for Pfizer because that's the one that's approved. So May 27th at the high school for the first dose. Second dose would be June 17th. Lawrence at May 25th and Morse Pond at May 25th, with Lawrence being in the morning and Morse Pond being in the afternoon. So you could reach out to the school department for that. If they've done some outreach, they've got a lot of appointments booked. There's still appointments available. So if you want to do that for 12 to 18-year-old that are currently in the school system. As far as vaccinations, we're at 69% on the county, which is a 1% increase that have had at least their first dose, and 57%, which is a 3% increase for second dose, which we consider fully vaccinated individuals. For Falmouth, here we are, the data is of 5/18. We're total at 70%, which is not everybody's eligible because under 12, if you factor that out, you can see at the bottom that 77% of all eligible residents have received at least one dose. That number percentage actually went down a little bit because now we added a category of 12 to 15-year-olds. So, and it was at 80 when it was 16 and over. So we'll get back up there as soon as there's enough time for the 12 to 15s to get their first dose. And 64% of all eligible residents are fully vaccinated. You can see that we've had roughly 0 to 1% increase. Most of our increase, the reason why I don't show the increase from the previous week is the state it was originally 0 to 19. Now they've broken it out to 12 to 15 and 16 to 19. So I don't have a percentage from last week because they've changed the way they report, which is better this way. But you can see a huge 58% between 16 and 19, and that's been eligible now for a couple of weeks. So that's where we're seeing probably most increase. Obviously, second dose, you're getting a lot of increase, especially in the 20 to 65 age range. If they got it recently, if you're doing Moderna, it's a 28-day delay because that's how long it takes to get before you can get your second dose. So we're seeing people finishing off their second doses, and the younger age groups are still increasing. Probably between 12 and 19, we'll see the biggest increase. But you can see it's pretty right there, about 75 and older are over 95%. When you get to 65 to 70, we're at 90, so 9 out of 10 people. 50 to 64 is roughly 8 out of 10 people. 30 to 49, 7 out of 10. 20 to 29, 6 out of 10. So I guess that makes sense. That's what we probably would have seen. We're definitely ahead of the curve with vaccinations countrywide. This is pretty solid, pretty high level of vaccination rate. So as far as COVID cases go, there's 1,566 cases, with 16 cases over the 7-day period, roughly about 9 households. There's been obviously multiple. There is 30, last time the state had reported about 30% of all cases of the B117. We know that does spread more rapidly, so in a household you'll have more of a tendency to have multiple cases in a household. We had 7 probable cases. Roughly less than 2% of total cases are continued still in isolation. And we've always done better than the county in terms of our case count. So we still do the contact tracing. If you're vaccinated, you don't get quarantined, but we still have to go through the process, and we still do that for every case. Nothing's changed on that end. You can see our weekly case trend. We've been averaging right around 15, 13, 15, 16, right around in that range for 3 weeks after having a drop, a pretty sizable drop from right around early-ish in April. So that shows that's kind of where our baseline is now, and as we continue to vaccinate and we contact trace those really well, that could drop into the less than 5 range, which I hope that we would be relatively soon. In terms of our flattening of the curve, that term you guys are all familiar with, you can see we really flattened it out last year. We can start seeing a flattening now. We've had 2 spikes, which was right around that Thanksgiving. Right around that, started right around the holidays or after Thanksgiving and continued on to the end of January was our biggest point of increase. And then we had another spike with the Mid-Cape spike that occurred in March, early April. But you can see we're sort of flattening it back down, and that's to be expected. As far as the metric, you see there's only 2 towns in Massachusetts now are red. It's New Bedford and Lawrence. The rest of the towns are either yellow, and even the yellows have gone way down. The only town on the Cape yellow would be Barnstable, and it looks like Edgartown and Vineyard Haven are as well, and Nantucket are yellow. We're solidly in the green. We have a slight, we were at 1.87, we're at 2.83, very close. 1 case at this point makes that kind of a difference, 1 or 2 extra cases. So we look good on that end. The county positivity is at 2, the state's at 1.21. So we're still on the bit higher than the state, and we've been like that since that Mid-Cape outbreak that we've had. But we're solidly in the green, and we should remain in the green, hopefully for some time, or get better and get into the gray. You can see case counts. This is just the case counts for 3-day average case count. You can see it's definitely a drop-off. You can see that drop-off from late April, early May, and it just continues on to drop off. Hospitalizations aren't still around that 5 or 6. Again, it depends on who has the misfortune of getting COVID. If somebody's elderly and wasn't vaccinated, things of that nature tends to be more hospitalizations. We're actually higher today with 5 and 1, and they're 1 and 2 at Cape Cod Hospital. Usually it's been the other way around, but that could be who it affects and so on and so forth. And an individual may be in the hospital for an extended period of time, and that number stays in week to week. And so that's a little bit higher than you would think for the amount of cases we had. It's not just Falmouth residents in the hospital. At Falmouth Hospital, we do other towns, but that's where we are with that. State trends show that we're averaging under 1,000 cases for a week or so now, at least a week. 500, 300, 400 is what we've been seeing. Deaths have been below 10. There's a delay to death, so as the cases stay lower and lower and lower, the deaths will stay down and down. Positivity has been around 1%, averaging 30 to 50,000 tests. So we're all these trends, and this is the trends keep showing it on a flat to downward trend, and hence the reason why they've decided to lift all of the guidance. COVID testing hasn't changed. You can still get COVID tested at CVS, at the hospital, if you have your physician sign up. Barnstable County's still doing it for now, going on CapeCodFairgrounds.org. You can go anytime or call anytime, Monday through Friday. It'll be a Tuesday or Friday appointment. The fairgrounds will eventually become the fairgrounds again. We're not going to be doing clinics. If there is maybe one more, but we just did one this week, and there wasn't a lot of people there. So you still have the same spots. Community Health Center will probably start vaccinating out of their site they might be doing small things. I haven't spoken to them this week, but for them to help us by bringing the nurses, bringing the vaccinators and the vaccine over to the fairgrounds is what they've been doing over the last few weeks. It's starting to not make sense. So that's where we are. So recap, virtually all guidance and orders relating to COVID-19 expire on May 29th. Vaccine eligibility is everyone over, that should be changed to 12, sorry, that is 12. Falmouth residents' vaccination rates are a little bit higher in the Cape, definitely higher in the state, similar to other Cape towns. We're all within a few percentage of each other on the Cape. Plenty of vaccine availability, please take advantage. State metrics are showing a decline in cases, decrease in serious illness, Falmouth decrease in cases as well. School-based clinics next week for, sorry, I misspelt that, for contact the school department if you require more information. Those have been, you'd want to do that today, they're next week, so you want to get onto that really quick. As soon as you hear this, on Monday, the latest, you should be signed up for that. So that's where we are for this week. Again, the guidance goes away, so the next time we do this, well, it'll be another week. So it's early next week, the following week. So we have one more presentation next week that will talk about it, but the guidance is set to expire on the 29th. And so that's it for our update for this week, and I'll talk to everybody next week. Thanks.